Welcome back to another episode of Out of the Blank Podcast. Walt, it is a pleasure to have you back on the show. Would you mind reintroducing yourself to everyone out there listening?
Sure. My name is Walt Karniski. I'm a developmental pediatrician, practiced for about 40 years, now retired, and recently wrote a book about ADHD entitled ADHD Medication. Does it work and is it safe? So I'm happy to be here and look forward to talking to you, Rob.
We're going to cover a wide range this podcast, but the last time you were last on, you talked about the evolutionary importance of ADHD when it actually served a factor in society. And it was an interesting take because I think most people like myself who have ADHD have kind of been shamed for having ADHD. So it was an important factor in addressing a positive thing about ADHD that kind of makes me look at it a little bit differently.
Right. Well, I mean, you have to ask yourself, why would why would this evolve? Why would ADHD evolve the way it did? And Tom Hartman is a psychologist who wrote a book called ADHD, A Different Perspective. And he presented this concept. Unfortunately, it's very difficult to do any research on that. So this is only a proposal. But basically what he said is that that ADHD in, say, 100,000 years ago would have actually been a positive characteristic. And here's how that would work. So assume that you're a caveman 100,000 years ago, and your job is to go out every morning and to pick berries off a bush and bring them in for the tribe's breakfast. So you're out one morning early picking berries, and all of a sudden you hear a rustling in the bushes behind you. What should you do? What would you do?
Most people would probably run, but I'd probably do something, alert others or do something of that sort.
If you ran and you ran back to the cave, and that rustling in the bushes was just the wind, and every time the wind blew, you ran back to the cave, you would never get the berries picked. The tribe would be angry at you for not picking the berries, and you would be rejected from the tribe. You wouldn't then relate to the other women in the tribe. You wouldn't have children. And I think you can see that basically what would happen is that a person who is not paying attention would suffer the consequences of that. So I think what happened with the evolution was a person who had ADHD was distracted, who could turn and look and see what was causing the rustling in the bushes behind him. And if it was a saber-toothed tiger, he can pull his knife and defend himself. If it's the wind, he can go back to picking the berries. So a person with ADHD really, back in those days, would have thrived and actually become a leader of his tribe.
Aren't one of those the contributing factors to early mortality with people with ADHD when it comes to being high risk?
Well, they are high risk factors, but I think what happened with the whole idea of the evolution is that distractibility wasn't really seen as a negative; it was seen as a positive. The child with ADHD 100,000 years ago would then grow up being the leader of his tribe because he was the one that would survive. He would have children with ADHD as well, and they would lead the tribe. Everything goes along just fine for 100,000 years until we get to about the 19th century. And what happens in the United States and all over the world is we began requiring children to go to school. And suddenly, those children who were working on the farm or working in the father's blacksmith shop have to work in school and have to focus and pay attention. And those children who were easily distracted and protected from that saber-toothed tiger by their distractibility no longer gain any advantage by that. As a matter of fact, they are seen as having a disability. But in reality, they are simply a child with distractibility. It's just that we see that as a negative in the 21st century. It was positive up until recently. So the point is that it is a physical neurologic difference, but only that. So I don't know if that.
Well, would you cause it from being hyperactive and being put in a school scenario where you have to sit still and focus, or would you say it's because usually with ADHD people there has to be individual time spent, like usually extra time for tests, extra time for care, usually in individual classes, they call it usually enrichment, but a parent could do that.
Well, but those extra requirements are required by their ADHD. If they didn't have ADHD, those accommodations would not be necessary.
Yeah, that's what I'm saying. So, I mean, the prevalence of ADHD, it really wasn't, I mean, as noticed before, it was actually treated better back maybe however long ago because of the fact that it was more beneficial to have it. And now you put the school setting gets involved. You have to sit still. You got a lot of energy. It's now becoming more of a problem than an issue.
You know, in my book, I actually introduced the book with a description of Fidgety Phil, who back in the 17th century, his father would write stories for him and draw pictures of this Fidgety Phil. And the way he describes Phil is as a child with ADHD, a child who can't sit still, who can't focus on one thing, who's trying to focus on multiple things, who's easily distracted. And this is considered one of the first explanations of ADHD, but it wasn't until the 18th century that was described as a phenomenon.
Now, do you believe in an overdiagnosis issue, or do you think we're just better at detecting it?
I think both are occurring. I think there's overdiagnosis and underdiagnosis at the same time, obviously not in the same child. So some children are overdiagnosed, meaning that they are diagnosed with ADHD when they really have something else, like autism, like a learning disability, like anxiety. You know, I will say we started a school 20 years ago called Tampa Day School for children with ADHD and learning disabilities. And what we found in running that school was that many of the children who we initially had diagnosed as ADHD, who've been diagnosed by their physicians or even by us and referred to their physicians for treatment, we found that actually many of those children had anxiety disorders or obsessive compulsive disorders rather than ADHD. And then we had to make modifications in the classroom for them, but in a different way for the ADHD child.
Like what kind of adjustments?
Well, I think the biggest difference in a school like Tampa Day School is that when a child is not learning, we don't blame the child. We don't say you're not paying attention, so start paying attention so you can learn better. What we say is that if the child's not paying attention, then we're not doing our job right. We're not making the classroom attentive for that child. And so what we do when we see a child who's having difficulty is that we modify the teaching style to adjust to that child's strengths and weaknesses. And
Now,
and
but taking on sole responsibility, that would you just notice that from the regular education systems were more pointing the blame towards the child that was more disruptive instead now you're taking on the responsibility. That's very, I mean, high of you, I would say.
it's very what?
High of you. Like it's good for you to do that. Take the responsibility instead of pushing it on the student.
Yeah, in our opinion, that's the only way really to teach children. And the interesting thing is that some of the parents who brought their children to Tampa Day School, they would have their child in the school for a couple years, and then they would come to the director and say, um, his sister is now entering the first grade. Could he come to Tampa Day School? And she says, and the director says, well, what's the diagnosis? And she said, well, there isn't one. I just think that she would do well at the school. And basically what we were getting from some parents is that not only was this a good approach for children with ADHD and learning disabilities and anxiety, but it was also a good approach for uh, the average child or the superior child who so it really is a question of adjusting the educational approach for that child's strengths and weaknesses.
Now, how do you get other schools to adopt that method, or is this just something that has to be limited per school?
That's a difficult question. We haven't been successful at getting other schools, especially public schools, to address that. The public schools have a responsibility to everybody that's in their classroom.
Now, even with the prevalence of ADHD being diagnosed more and having, I guess, a more reasonable take on the number of people that actually have ADHD compared to what we thought previously, they're still not up to adopting new methods to be able to work with that individual child.
No, unfortunately not. But when you ask about overdiagnosis, I'm reminded of a story when I went to see my dermatologist one time, and he was out of town. So I got his partner, and I had never met her before. She walks in the room with the chart and she looks at me and she says, "Oh, I understand you're a developmental pediatrician." She said, "What kind of kids do you see?" And I said, "Well, we see children with ADHD and learning disabilities and anxiety problems." And she said, "Oh, ADHD, that's overdiagnosed, isn't it?" And I sat there and well, I didn't know exactly what to say at this point. And so I looked at her and I said, "Well, let me ask you a question before I answer that question." I said, how many of your patients over the age of 60 have skin cancer?" And she said, "Oh, well, about 40%." And I said, "Oh, that must be overdiagnosed then." And she said, "No, no, no, it's not overdiagnosed. It's because people don't take care of themselves. They don't put a sunscreen on." And she said, "Oh, wait a minute. I see what you're trying to do." She said, I said, "Yeah, ADHD, the prevalence of a disorder or how often a disorder occurs has nothing to do with its validity." And what I mean by that is ADHD could occur in 100% of students, and it still could be a disability if we leave schools the way they are and we continue to teach children for non-ADHD students.
Well, just a little side thought, but what have you thought since you're interested in kind of medicating ADHD and kind of talking about it? What have you thought otherwise besides medication that could be used in the school systems to be able to advance ADHD students instead of isolating them?
Really, this is going to sound maybe iconoclastic or something, but uh, I believe that ADHD is a medical condition. It's not a disorder, but it's a condition that is caused by a difference in the arrangement of the neurochemicals in the brain and the way that those neurochemicals work at nerve endings. So, but it's not. It is simply a characteristic of being human. But those people that have that distractibility would have done fine for 100,000 years ago. It's just they're having difficulty with our current school system. So I think it behooves us to modify the approach for each individual child. And why not extend it to all children? So that some children are visual learners, some are auditory learners, some have to have repetition, some need to sit in the front of the class so that they're not as easily distracted. So there are modifications that teachers can make for everybody in the classroom that would improve the educational program for everybody without disrupting those children who don't actually need it, if you will.
Now, would that be better, so I guess solved based on the technology that we have now as well too? I mean, how much can you teach visually wise? And ADHD in a tablet is probably the best thing in the world. I mean, sure, you'll go off on some tangents here and there, but obviously it's like a really good focus when you talk about the number of things, apps, and being able to do multiple different things on a little electronic device compared to maybe 20 years ago when the computer was just kind of kicking off.
Exactly. Right. And so in a way, the computer has been both a blessing and a curse for kids with ADHD. It's a blessing in the sense that you can more easily modify the educational program through a computer to meet that child's individual needs. But on the other hand, it may enhance that child's distractibility. because he's sitting in front of a computer and easily distracted by what he knows he can get to with the click of a button. He can be watching a football game or a YouTube video.
What are some of the important things when it comes to comorbidities that roll with ADHD?
Well, I think the most important thing about comorbidity is recognizing that it occurs. When you get a diagnosis of ADHD, what parents don't realize and what a lot of physicians don't recognize is that ADHD often occurs with another diagnosis about 40% of the time. And that other diagnosis may be a learning disability. It may be mild characteristics of autistic spectrum disorder. It may be a learning disability. 30 to 40% of children with ADHD have a comorbid learning disability. And the reason that it's important to recognize those other problems is that those other problems will not respond to stimulant medication the way the ADHD symptoms do. So if you give a child Concerta who has ADHD, he's going to focus and concentrate and attend better. But if you give a child Concerta who has an anxiety disorder, you're going to enhance that anxiety and make the anxiety worse. So if you don't recognize that you're dealing with both ADHD and anxiety, or just anxiety alone as a comorbid, then you're not going to be able to treat that child. And what usually happens is the parents see the benefits and they see the negatives, but they concentrate on the negatives. Let me give you an example. I had a parent come to me with a 5-year-old child, very hyperactive, very impulsive, very distractible. He went through all the testing. We diagnosed him with ADHD, started him on medication, and the mother came back 2 weeks later. And I said to her, "How are things going?" And she said, "Oh, that medication you gave me isn't working." And I said, "Well, why not? Well, now he comes home and he throws his books on the floor, goes to his room and reads." And I said, "Well, what's wrong with that?" And she said, "Well, he used to come in, pull the cat's tail, run around the room. The cat would start screaming. He would knock over the lamp. I'd have to fix the lamp." He said it would go on. She said it would go on forever. So obviously that medication's not working. And I said, "Well, why?" And she said, "Well, he's depressed now. He's sitting in his room reading." And I said, "Well, if he had been born that way, would you be concerned?" She said, "No, no, he would have just been a studious child." And I said, "Well, what you're seeing now is that child without ADHD."
Now,
As
is that a contributing factor from just people becoming familiar with how a person normally is and then adjusting to that familiarity? And they may say they want change, but how many people actually really want change once they get it? They're like, I actually preferred the evil I knew, like that type of discussion. But also, when like for ADHD people face it all the time. They're usually very impulsive, very talkative, very engaging in social interactions. But then it can also go the opposite, where they'll end up having a day where they just cut off and don't talk and they're silent. And then people really question like, are you okay? Is everything going on? So I just don't feel like talking. And they're not used to it. And people get concerned because they're used to how you were before when they knew you all this time, and they don't understand the fluctuations with mood when it comes with ADHD. So, I mean, it's not a specific medication thing, but I'm just wondering if it's the comfortability factor, the familiarity that people have with who you are. They know how you're going to be on this day, and then sometimes you're just unpredictable.
well, you're bringing out an important point, and that is that the symptoms of ADHD are all normal behaviors if they occur in certain circumstances and with some moderation. And so, I mean, how common is it for people to forget where they left their keys, or to be sitting in a presentation and to start thinking about the errands that you have to run after work today, or something? So there's a lot of situations that are completely normal behaviors. In most of psychiatry, with the exception of a person who's psychotic and hallucinating, most of psychiatry is an an exaggeration of those behaviors. So more distractibility, more impulsivity, more anxiety. Anxiety is actually a positive characteristic if it occurs in moderation. What anxiety does is, let's say a child, it's Monday morning and he knows he's got a book report due Friday. Well, he doesn't get anxious about that. But on Thursday night, he starts getting anxious that he hasn't read the book, hasn't written the book report. And so he starts reading the book, glances through it, doesn't read it very well, writes up a quick book report and gets a D on it. And that child's capable of getting an A, but he let things go to the last minute because of his ADHD, for instance, and that interfered with his ability to be who he really is as a child.
But that can also be the complete 180 where a kid really focuses in the last day or so before a project and gets a very high grade because of their hyper focus ability.
That's true, but it's also somewhat painful for that child. Waiting till 10 o'clock in the evening Sunday night to start writing that essay that's due Monday morning. The very bright child may still get an A on that, but as the workload increases and as the requirements become more and more complex, suddenly that ability to be distracted is no longer seen as a positive characteristic, it's seen as a negative.
Now,
And
your
again,
perspective is what I appreciate because you're not about eliminating ADHD. Like a lot of people are like, no, we got to medicate this kid. We got to do. You're more about like you can make the kid struggle less if you just funnel it towards looking at helping out some of the symptoms. I mean, a lot of kids don't know what they're experiencing. I didn't know until I was 23 and started learning about ADHD that my personality was actually ADHD symptoms.
but I am also saying that even though it's not a neurologic abnormality, it creates a great deal of discomfort and lack of success in life. Let me point out, for instance, and this is going to be a little bit scary for some of your listeners, so wait till I get to the end of this. But there have been many research studies of ADHD in adults, and one of the things that they've looked at is the size of certain areas of the brain. And they've found that in people with ADHD and children with ADHD, that those areas of the brain are, there are three areas of the brain that are smaller in people who have ADHD. Well, the interesting thing about it is if you follow those children to adulthood and scan their brains again as adults, those three areas of the brain will still be smaller in people with ADHD. But for those children who were treated with medication as children and then become adults, and you scan their brains again, those three areas of the brain are now normal size, back to normal size. So I don't know what the medication is doing long term, but I do know that the medication has a long term effect. So even for those children who were on medication as children, not on medication as adults, have a better outcome as adults if they were on medication as children. And let me give you an example. There are adults with ADHD are more likely to be in a car accident. They're more likely to have their license suspended. They're more likely to go into bankruptcy. They're more likely to have higher credit card debt. They're more likely to have different job changes. They're more likely to have children born out of wedlock. They're more likely to be divorced or separated. The list goes on and on of the difficulties that people with ADHD have in this world, trying to meet the requirements of an ADHD person in an ADHD world.
Now, would you be able to look and take that same exact data and be able to apply to something else under a bigger microscope? I mean, if you look at ADHD being under the microscope, you're going to come up with all these things. But you could take somebody who's in their 20s, who's a white male, depending on where their location is at, and get way higher statistics and get way different data as well, too, on a basis of things when it comes to alcohol, drug. I have plenty of friends that don't have ADHD that have a way more addictive personality than I do, and I'm supposed to be the one that's more likely to be addicted to things.
Right. Well, but I understand that if we got rid of ADHD and ADHD suddenly disappeared, we would still have individual human differences. We are still human beings. We're not perfect, and every human being has strengths and weaknesses. Some of those strengths are so strong that they become successful in life, and some of those weaknesses are so weak that they have difficulty in life. And I think that the secret and the trick is trying to balance those. Let me give you another example. If you were a doctor and you had a patient who suddenly was normal, but suddenly started slurring his speech, complained of a headache on the left side of his head, had trouble walking, lost his balance, would you say that those are just all normal behaviors? No, you would say get that person to an emergency room. He's either having a stroke or a
A
heart attack or
tumor.
something.
It's
Yeah,
a
yeah,
tumor.
exactly. Something. So, but the same thing doesn't occur with ADHD because almost all of the ADHD behaviors are normal behaviors at some point. Losing your balance and slurring your speech are never normal, but losing your keys is normal. And so at some point people forget what they're talking about, or they forget what they're saying, or they forget to do something, or they're easily distracted when they're listening to a presentation that's boring for them or not interesting to them. So I think what the point here is that all the ADHD symptoms are normal behaviors when they occur in moderation. But what happens in ADHD, they occur all the time or most of the time, so that that person has those behaviors as a disability rather than a strength.
Well, would you look at with the education system also from the medication side and also something where it comes to better education about ADHD? I feel like if more people that don't have ADHD are educated on it, they would understand it more when they come across someone who does have it. And also someone who's a little kid who has ADHD barely knows what that even means. If they were taught better how to control their symptoms or what they're going to be experiencing, maybe they would learn better social context situations. I mean, a lot of the stuff that we do might be right in certain scenarios, but not in maybe the scenario that we're using it in.
I think that's absolutely true. Uh, and again, you're emphasizing the importance of recognizing those behaviors as whether they're part of an abnormality or whether they're part of a disability that is interfering with that child's to succeed, or is it just part of his personality and characteristics? The ADHD is, you haven't asked me about what causes ADHD, and the answer is we don't know, but we do know it's genetically based. We do know that about 70% of children with ADHD have a parent with ADHD, but usually they've been undiagnosed. And usually I'm the one, when I'm seeing the child, that recognizes that the father may have some of the same symptoms. And if I mention that, the father will say, well, I got along just fine. And of course, then the wife will roll her eyes.
Well,
Uh,
everyone always examines the father, which is the father's more than likely not going to be the one that's going to look into medication for their child. They're like, "Oh, he'll work it out. He seems fine to me." It's how my dad is. But nobody ever looked at the mother because the symptoms for a woman experiencing ADHD are a lot different than the symptoms for a male experiencing ADHD. My mom has the ADHD, and it took a while for all of us to realize that it wasn't something, you know, like a bipolar disorder. It was ADHD symptoms, but it was because women channel it differently.
when I was in my fellowship learning to become a developmental pediatrician, uh, I remember discussing this issue. The ratio of boys to girls was 10-1 at that time. The research was showing that there were 10 times as many boys as there were girls diagnosed with ADHD. When I joined the University of South Florida and became on faculty, and so 15 years later, I was looking at some of the research, preparing for a presentation, and I realized that the overall research was now indicating that the ratio boys to girls was 5-1. Recently, I saw an article that said the ratio was 3-1. Of boys to girls is now considered close to 1-1. Uh, but the difference is that in boys, the boys are hyperactive and impulsive and easy to recognize, whereas the girls may be quiet and more withdrawn and not recognized until they're in fifth or sixth grade, and especially if they're very bright. And they're able to compensate for their ADHD, they can actually be successful until seventh and eighth grade, until the workload becomes so large and so heavy that they can't, that they're spending 6 hours a night doing their homework because of their distractibility. So the answer to your question is yes, the research shows ratios of 3 to 1 boys to girls right now, but I suspect the ratio is really closer to 1 to 1.
What about intervention? Do you think it should be in early childhood? Do you think it should be later adolescence when we talk about medication usage?
I think it should be as early as possible. And the unfortunate thing is that it really is difficult to diagnose ADHD in a preschool age child. And most physicians are reluctant to start a child on medication at 3 or 4 years of age. I found that if a child was started on medication earlier, they did much better. If you wait until they're 9 or 10 years of age, their self-esteem becomes affected by then. By then, they've already recognized that they're not succeeding in school. They're not doing as well in school as their friends or their brother or sisters doing, and they're having difficulties. By that point, they consider themselves stupid or dumb or not able to do the work, and they begin to downgrade themselves as a person. When that happens, it is very difficult to intervene and reverse that process. So my feeling is starting treatment as early as possible. The research shows that those children do better in the long term, and they are less likely to have the self-esteem issues that a person with ADHD has who is not treated.
Now, if stimulant medication is more effective than non-stimulant, which would you suggest using, though? I mean, which would you look at from an observational point of view as being, I don't know, easier on someone who might be hesitant on medication? Do you think non-stimulant still has its usages?
Um, yes. First place, the stimulants are clearly more effective than the non-stimulants. All of the research documents that, and maybe a few studies have shown that some non-stimulants are equivalent to stimulants, but only in certain children and only in certain circumstances. And the circumstances that I see the non-stimulants as being necessary are when there are a lot of comorbidities. So if a child has ADHD and anxiety, and you start them on an ADHD medication, their ADHD will get better. They will focus better. They'll be less distracted, but their anxiety will increase. So there's a tendency then to add an anti-anxiety medication. And when that happens, the anxiety gets better, but the ADHD behaviors get worse. So then there's a tendency to increase the dose of the stimulant. Now, and if you can see what's happening here, as you increase the dose of the stimulant, the ADHD starts getting better and the anxiety gets worse again. And what you end up with is a child that's overdosed on 2 medications and still not receiving the benefits that are necessary. So those are the situations where a non-stimulant is helpful because, not helpful, but almost necessary, because the non-stimulants will help with ADHD about 80% as well as the stimulants. And that's better than what they were doing before, far better. But it'll also treat many of the comorbid symptoms as well. So it'll reduce the anxiety, reduce the obsessive compulsive behaviors, reduce oppositional and defiant behaviors, and reduce the ADHD as well. So that's the benefit of the non-stimulants. It's just that you have to compromise a little bit on the effect on the ADHD symptoms in order to get the treatment of the comorbid symptoms.
When we talk about the immediate kind of effects of the medication that they choose to use, it usually happens within 1 to 2 hours, and it's something that you can choose to take it one day and choose not to take it another. But what about when someone takes it every day for years upon years, and then they decide to stop using it? Have you seen any experiences and trauma related to that?
Well, the biggest problem I see when that happens The biggest problem I see when that happens is that, of course, their ADHD symptoms return, and they return immediately. They return the day. I mean, the effects of medication are almost immediate. When you take a medication, you can begin seeing the positive effects within a half hour, depending on which preparation of medication you're taking. Some medications last longer, but they also take longer to take effect. And so you'll get different effects from those.
But what about when someone takes it for maybe an extended period of time, like 10, 15 years, and they decide to just hop off of it? They experience a little bit of, I don't know, depression, a lot of depression, to be honest with you, from my friends that would take their medication all through their high school, elementary school, all of that. And then when they became adults, they stopped taking it. And they haven't really been right because they know what they are like before and how they functioned before. And now they're trying to do it unmedicated, which just makes them feel like maybe they just don't fit without medication.
Right. Well, the interesting thing is that people are always worried that an adolescent or a young adult is going to get addicted to these medications. And the problem that I had when I was practicing was not that children would become addicted to them, but that they wouldn't use them. When they got to be teenagers, they felt that the medication wasn't really helping them. And the reason that they felt that way was because the medication made them feel more average, more normal, and they recognize that as something negative. I one time had a girl who I saw at 12 years of age, diagnosed with ADHD, put on medication. She had a good response, but the parents were reluctant to use the medication, so she didn't come back to see me again for 5 years. And then 5 years later, she's now 18. She's a freshman in college. She's flunking out of college. She's getting F's in all her courses. And she said, I came to see you today without my parents because my parents are against me using this medication. And I didn't like using it either, but now I feel like maybe I need it. And so I said, well, what did you feel when you took the medication? And she said, well, the crazy thing about it is I didn't feel all that different, but my friends told me I wasn't as much fun to be around. I said, what do you mean? What? She said, well, when we got together, we would always laugh and joke about things and we would just have a great time. And they said I was too serious. And so they stopped being my friend. So I started her on back on medication. Her grades improved. Within 3 weeks, she came back and said her grades were up to A's and B's now. She was feeling much better. And I said, well, how are things with your friends? And she said, oh, well, my friends actually think I'm a better friend on my medication now. I said, what do you mean by that? And she said, well, when I was off my medication, I was easily distracted. I wasn't listening to them. I was interrupting. When I'm on my medication, I listen better and I'm just a better friend. And so I say to people, what happened to that girl between the 12-year-old girl and the 18-year-old girl that's now in college? How did she change? Well, she didn't change at all. What changed was the expectation of her friends. So her friends saw her as as being more fun to be around when she was letting her ADHD be more flagrant. But when she was an adult, the friends saw her as a better friend when she was more focused and on medication and listening to them and not interrupting. So I think that points out to the differences. Well, but she said the thing that was crazy is that she felt no difference. She felt perfectly normal, which is what you want them to feel to begin with anyway, is to have a relatively average, normal feeling. You don't want to feel like you're in a fog all the time. And I think the ADHD medication does that, that it helps with the behavior, but it also helps with the thinking process.
Now, when you talk about long term, not side effects, but when you talk about long term usage of medications, when we talk about career opportunities and we talk about social success and we talk about other things that implement into factors when you become an adult, if you look at the prevalence of people that work in high risk jobs, oil industry, construction workers, things like that, they're very working labor task. A lot of those people's lifespans are cut dramatically short because of the dangerous job opportunity or job that they chose. And a lot of those people have something where it was a school issue, or it was something where they didn't pay attention. A lot of people in the construction force that I know have ADHD. So it gets them moving and has them in a physical labor activity, which is what they like. It's better than an office setting. But how much long-term opportunity wise is there a gain in a person's life status adjusting for the high risk factors of early mortality or early mortality, and things when it comes to addiction and things of this sort? I mean, you're looking at putting a child on medication, early childhood. What's the long term, instead of looking at the side effects of the drug, what's the long term benefit of their social and career opportunity success?
Well, or you could ask that question differently by saying, what's the long-term effect of not treating them with medication? And the research has answered both of those questions in the same way. Those people who are diagnosed with ADHD and are not treated with medication as children have much more difficulty in life with all of the things that I mentioned previously: job performance, social interaction, um, marriages, relationship with children. So all of those factors are more negative in individuals who have ADHD and are not treated with medication. In many studies that have been done, those people who have ADHD and were on medication were indistinguishable from the controls. If you remember, a control is a person that doesn't have the disorder and is acting as a kind of and I don't know what the word is, but acting as a baseline from which to judge how different the other person is. I don't know if I'm
Oh, they're
saying,
like a control group?
yeah. Well, I mean, a control group in a study basically is the group that doesn't get the treatment, and the treatment group gets the treatment, and then you compare the results of the two on certain measures. And if you look at those people who were diagnosed with ADHD as children, treated with medication with children, and compare it against children who were diagnosed with ADHD but not treated with medication, those children who are treated with medication have a far better outcome in all of those areas that we just talked about.
Now, can
Less
any
car
of
accidents, better job performance, more social interaction, more likely to stay married, more likely uh, to make more money, more in their jobs, more likely to be successful, more likely to be happy, and the list goes on and on and on. And all of that is long-term effect for medication.
now how
And then
much
when
would
I'm sorry to interrupt, but then remember also the changes in the brain size that occurred with long-term use of medication. The actual brains, those three areas of the brain became more normalized on medication, even long-term, even in people who were no longer on medication. But if they had been treated as children, they had more normal sized areas of those three areas of the brain.
Now, how much would this complete a lot of the problems that people with ADHD voice and express when it comes to not being able to function or feeling like they have to try harder? The medication could fix that.
I'm not sure. I'm not sure what you're asking with that.
Well, if you talk to anybody who has ADHD, they're either told they're not trying hard enough when they're trying pretty hard as it is. And it seems like a lot of the things that they're experiencing when it feels like they just are half the person that maybe a normal functioning person is. A lot of the stuff medication can fix when it comes to being more attentive to a certain problem or scenario, having their mind focused on it, or just decreasing their energy level to a point where they can have an ability to focus and have a meaningful conversation and develop a deeper relationship with a lover or anyone, friendship.
Yeah, exactly. I mean, you pointed out really the importance of recognizing a disorder early. I mean, we know that about so many different disorders. If you have diabetes or vision problems, that you'll do much better if you're starting treatment early than long term. It affects self-esteem. It affects the way you feel about yourself, and that is difficult to reverse once it occurs. Once it occurs that a person feels that he or she can't function the way his peers are, then you've got a failure on your side, and it shouldn't have to be that way.
Do you think this would maybe decrease suicidal rates amongst young youths and teens? I mean, we talk about the depression, the anxiety issues, but that social isolation factor, a lot of people might like having that day where you don't have to do anything, but keeping that up for months and months until it turns into years is not a good thing.
Exactly. Now, the thing about it is depression is one of the comorbidities that are seen with ADHD, but usually only about 10 to 20% of the time do we see depression with ADHD. And of course, there's always the question about, was the depression caused by the chemical imbalance in the brain, the same thing that we saw with the ADHD, or was it caused by that child having ADHD in a non-ADHD world? So that can cause depression as well. So if a child is uh, now divorced and not able to see his children and just lost his job, and everything can get overwhelmed at that point, and it'll cause depression. So I think the first trick is to decide whether we're dealing with a biochemical depression or a situational depression, because the treatment is so different.
Do you know why there was an Adderall shortage and why so many people were panicking that they weren't going to be able to get their Adderall?
I know what's been said. I don't know if it's the truth or not, but it's been said that the FDA has limits on the amount of Schedule 3 drugs that can be produced. I'm sorry, Schedule 2 drugs. A Schedule 2 is a drug that has not yet been approved for general clinical use, but more for research purposes, and has some addiction potential. Whereas the stimulants are classified as drugs in that range, the FDA says that Schedule 2 drugs must be limited. So they put a yearly limit on the amount of medication that can be produced. And I think what's happened is the demand for the medication, especially during the pandemic, increased to the point that it overwhelmed the availability of the medication.
Why did people need it during the pandemic if they're just sitting at home? You don't need to really go out and be socially
Because they were
accepted.
sitting down and doing work on the computer and finding that they were very easily distracted. Whereas in a classroom, the teacher could redirect them. That wouldn't happen at home when they were by themselves doing a lesson. So it was easy to pull up Snapchat in the background, or some other program in the background, and get it from the distractibility that occurred.
It's interesting to me because I think everyone started thinking that they had a little bit of ADHD during the pandemic. I was like, yeah, because you're sitting at home doing nothing. And even when you're trying to work, you want to go watch Netflix.
Yeah, exactly. Um, but I don't know if that's the real answer. But what the FDA is saying is that it is that the allotment, or the amount of medication that was allowed to the pharmaceutical companies, was overwhelmed by the demand. And we'll have to see if that occurs, and whether the FDA raises the limits now.
Well, Walt, what's one takeaway you want to give listeners out there when it comes to ADHD and medication? Just something that they should keep in their minds when really looking at the discussion about it. Because obviously, if you go and Google this type of stuff, you're going to see either positives, you're going to see negatives, you're going to see all types of opinions. In my opinion, I think you have to try it for yourself if you think it's something that you want to explore, just to see if it works for you. It's kind of like glasses, either you need them or you don't. And plus, who leaves a bad? Everyone leaves a bad review. Nobody leaves a good review. So it's like you're going to come across a lot more people shaming it than talking about some of the positives they experienced.
Well, just remember that there is a relationship between how early treatment begins. I guess the concern that I have is that I've had many people come to me. Well, I had a 73-year-old woman come to me at one point and said that she thought that she had ADHD. And I said, "Why are you waiting till now to get diagnosed?" Well, we ran her through the tests, and indeed she did have ADHD. And I told her that and said, "But why did you wait until now to?" She said, "Well, all my life people have been telling me that I'm disorganized and distracted, and I just wanted to know why. I don't need medication now. I don't need to take medication because I'm 73. I'm not working. I'm doing fine. But I just wanted to know why I was having so much difficulty in my life." And I guess what I'm saying is that it didn't have to be that way for her. If she had, if their physicians had recognized her ADHD early on when she was in her teens or childhood, I think she would have had a much better outcome and a much better feeling. And she even demonstrated that to me when she came back and said that she's still having those same difficulties. And then she didn't want to use medication because of her age, but she always wondered what medication would have done for her. And I guess my other point here is that there are side effects to these medications, just like any other medication, but none of the side effects of the stimulant medications are serious, and none of them are irreversible. So every one of the side effects that we see, decreased appetite, difficulty falling asleep, irritability, other changes, all go away as soon as you stop the medication. They're not long-term. And secondly, none of those are serious. ADHD has not been associated with sudden death. Some people claim that in about 30 years ago, Canada suspended the use of Adderall because of sudden death. And they did the research on it and found that there was actually more people dying less frequently on medication than off medication. And it was probably because they were getting into less accidents. But you needed 20 years of experience and millions of people on ADHD to be able to demonstrate that minor effect. So my point is that these medications do not have serious side effects. They do not have long-lasting side effects. The effects can be dramatic in a matter of days. The effects can be lifelong and lasting throughout a person's lifespan. How can you not give medication a try when all of those positives are hanging in the air and there are so very few negatives associated with the medications?
Well, Walt, I appreciate the time you gave me to talk on my show again. It's always a pleasure being able to discuss this subject with you. But is there a place where people can find any of your links and any links to where your books are?
Yeah, yeah. Actually, you might want to visit my website, ADHDmedicationbook.com. It's ADHD medication book, all one word.com. And we have on that site a medication lookup feature in which you can specify whether you want to see long-acting or short-acting medications, chewable medications or non-chewable medications, capsules versus tablets, and it lets you specify all the characteristics you want of the medications, and then gives you a list of which medications are available. There are 40 medications that have been approved for the treatment of ADHD, but they are all one version or another of the two main stimulant medicines, and that's amphetamine and methylphenidate. Those two medications are in every one of the active ingredient in every one of those 40 medications that are used to treat ADHD. But the lookup feature on my website gives a person the ability to characterize what they want to get from the medication and see which medications are available for that purpose.
Well, Walt,
Uh,
I'm gonna link all your links in the description. It's been a pleasure chatting with you again. Thanks everybody for listening to this episode of Out of the Blind.